And immediately I started like worst case scenario, because I'm like, you see, for a year I've been dealing with this pain, and everyone was just like, it's a strained muscle and works. And I start picking people's brain, and like, it's not normal. It's not normal to have such painful periods that you have to call in sick. I was actually in surgery for about 3.5 hours.
Yeah.
There was that amount, huge amount of tissue or whatever in the body. And
Hello everyone, welcome back to our next episode of ziRight Girls. I'm Dr. Tembelihle Masina and I'm with my co-host, Dr. Thalia Isaacs.
Hi, I'm Dr. Thalia Isaacs.
Today we are joined by a special guest, Mandy Meyer, who is a lifestyle and fitness coach. And today we are going to be talking about endometriosis. Mandy is one of the women that is living with endometriosis. We just asked her to kindly share her journey with us.
So endometriosis, or endo as it is more colloquially known, is when the uterine lining or the tissue from inside the uterine lining is found anywhere but the uterus. So it can be found anywhere, most commonly in the pelvis, on the ovaries, on your tubes, in the spaces between the bladder and the uterus or behind the uterus. More rarely, we've seen it like on areas like the lungs. Some people have it in their brain, some people have it in their nose. So it's basically found anywhere other than in the uterus. These deposits of endometrial tissue respond to hormones the same way that your uterine lining would respond to it. But because it has no natural exit pathway, it can result in inflammation, and inflammation usually heals with scar tissue, and that's what causes the pain. It's very common. We find it in between 6 to 8% of women. So we're going to ask Mandy to tell us a little bit more about her personal experience. Mandy, when were you diagnosed with endometriosis?
so I was diagnosed last year, October. October 2024.
Okay. And what were the symptoms, or what was your experience leading up to that point?
Where do I even start? Symptoms, I had extremely painful periods, extremely heavy flow when I was on my menstrual cycle. Those were the two standout symptoms that I had. High levels of fatigue whilst leading up to the start of my period as well. And then some of the smaller symptoms which led to me trying to figure out what was going on was I had extreme pain in my groin area. Okay, so extreme pain in the groin area. And as that progressed, I started getting extreme pain in my lower back. And it was usually during ovulation and then also during my periods. But then it started becoming all the time. And it was there more than what it was not there. Okay. So like I said, heavy flow and extremely painful periods, to the point where it would get me to just sit on the floor or lie down on the floor, like very disruptive to my day. And I went to different doctors to try and figure out what this groin pain was, because I was like, with me being very active, running a lot, going to the gym a lot, it was getting in the way of everyday life. And it took several months to get a diagnosis of what was going on.
Can you tell us, like, what were the differential diagnoses, or what were you told it possibly could be other than endometriosis?
So I will say I started by going to a GP. So I didn't go to a gynae. That wasn't my first visit. And I got told, go to a GP, see what the pain is. And obviously they ask a lot of questions about, is sex painful, which was also one of the symptoms that I was having, was extremely sore intercourse. Again, very disruptive to your life. So I went to a GP, and their conclusion, and I went to several GPs leading up to this. I went to a number of gynaes as well. And a lot of the biggest conclusion was it's a strained muscle within my groin. Based on the fact that I did a lot of exercise. And immediately that conclusion was drawn. I went for sonar scans. I went for MRIs. I went for a lot of different tests to try and find out what this groin pain is. And eventually the conclusion was that it is a strained muscle within the groin. An orthopedic surgeon told me that I had hip dysplasia.
Oh.
So there was a number of different things that I was diagnosed with, but for me, I couldn't leave it because I knew that it was something else. I think as women, but anyone in general, but as women, like, we know our body, we understand our body, we understand when there's different pain.
Yeah.
And I knew deep down inside that this pain was not muscle-related pain. And what made it more difficult was when it comes to diagnosing that, or when it came to diagnosing that, was I monitor my periods on a period tracking calendar.
Okay.
I monitor any pain, I monitor any symptoms, anything that's unusual. And I recall monitoring that I had mid-cycle spotting. And that wasn't normal for me.
Yeah.
For a number of people, it could be normal. For me, it wasn't normal. So I started tracking this. I'm like, okay. And just when I was ovulating, I went to do a 25-kilometer mountain bike race. So it's a lot of exercise. So the doctor said to me, that's probably why you're spotting. I was like, okay. And then the next month when I was spotting, I did a very long run on the day that I was ovulating. And again, it came to the conclusion was, well, the exercising is too much and that's what's causing some of these symptoms. So it was a long road to get diagnosed with endometriosis. When I finally did, it was a huge sigh of relief, but also a huge level of emotions that came with it. Because it wasn't a simple diagnosis of this is endometriosis. Because you can't, I could be very wrong here, but from what I understand, you can't just look at someone or do a transvaginal ultrasound and say, you have endometriosis. And when I went to my current gynae, he said to me, on the transvaginal ultrasound, he picked up that there's a mass on my ovary. And immediately I started like worst case scenario, because I'm like, you see, for a year I've been dealing with this pain and everyone was just like, it's a strained muscle. So from there, he said to me, it could be two things. He said to me, it could be ovarian cancer, it could be a tumor on the ovary, or it could be a chocolate cyst, which is endometriosis. He said the only way to know is to get in there, do surgery, do a biopsy on what we find. So then immediately after the appointment with him, I had to go do blood tests. I think it's CA125 blood tests for ovarian cancer. And then we had I think it was about a 2-week, he was pushing to get surgery done ASAP. It was about a 2-week delay before I could get surgery, and my mind was just all over the show. I'm like, oh, geez. Anyway, so we did the surgery, and it turned out it was stage 4, deep infiltrating endometriosis. And it had grown all the way, I don't even know if that's the correct terminology, but it was pulling up onto the left ovary, and it was covering the ovary and pulling down onto the ovary. So a long road to discover or to diagnose or get a diagnosis of what it was. But when you get that diagnosis, it's like, okay, I wasn't crazy, because you're made to believe that.
Yeah.
I mean, I will openly say this. I was diagnosed, I do believe misdiagnosed. Again, that's my personal opinion, but with depression, with anxiety, with everything else except for endometriosis. I was put on depression tablets. I was put on anxiety medication. Everything that went with it, because for a lot of people couldn't believe that I'm going through this amount of pain. One of the professionals, and I hate not speaking badly of anyone, but one of the professionals actually said to me, I'm making the pain up.
Oh, wow.
And I'm like, and I started believing them in the end. And I'm like, maybe I am making the pain up.
Well, medical gaslighting is a thing. It is a thing. And as you said, we don't badmouth anyone. I think a lot of us as medical professionals, we interpret the information in front of us the best way we know how, but it might not be accurate. And we also have to, like, as humans, accept that we are flawed in that extent. But I'm so glad that you got your diagnosis and that you say, like, the mislabeling can now be removed and the stigma can be removed.
Yeah, thank you for sharing your story, Mandy. So Mandy actually just highlighted a lot of the common symptoms of endometriosis, one being severely, extremely painful periods that usually are disruptive to your daily life. Yes, some mild pain is normal during periods, but they should not be disruptive to daily life. Again, pain during intercourse, which may even be embarrassing for most people to talk about, even to their gynaes. So that's another important topic. And like Thalia has explained, that endometriosis usually involves the pelvic organs as well. Some people may experience urinary symptoms, such as frequency in peeing or pain when peeing. Sometimes there may be blood in their pee, as well as gastrointestinal symptoms. A lot of people do experience a lot of bloating, a lot of issues with their bowel movements, and a lot of people are often misdiagnosed. Like Mandy has been said, a lot of times women are just dismissed and labeled as irritable bowel syndrome. But I think the take home is that endometriosis should not actually be, painful periods should not be regarded as normal, and we should always investigate what is the cause.
Now that you mentioned irritable bowel syndrome, it's as I'm sitting here, more is coming to light. And I'm like, yes, there was that as well. There was not only symptoms, but it was also brought to, the table of maybe that is what is wrong with you, and then add to the stress or the stress and anxiety. And it's like being constipated, everything else that goes with it. So there's just so many symptoms out there. And I remember just growing up, and my mom had an early hysterectomy because she had such a heavy flow. She couldn't even go down to the shop without, her sanitary products just overflowing. And same with my granny, early hysterectomy, also painful periods. And I know it stems all the way back to my great granny, right? And that's a big thing because you get brought up in a way, and I don't put this on anyone, my mom, my granny, or anyone, it's just the way that it gets carried down. It's like, okay, they had painful periods. When I get sent home from school, or I request to go home from school because I cannot sit there anymore, it's sort of the norm, because it's like, yes, okay, but, and my mom would say, I also had painful periods. Granny also had painful periods. And you start accepting it as the norm. And it's like, okay, it is normal. Right. And as I start growing, or as you get older and you get older and older, I start researching things, because that's how my mind works. And I start picking people's brain, and like, it's not normal. It's not normal to have such painful periods that you have to call in sick. It's not normal to have, it's not normal to have heavy flow that you're too scared to go to the shop in case, or if I go run, wear all black and make sure that I have my tampon as well as my period panties. It's not normal. And unfortunately, we are, I want to say, made to believe that it is normal. And that is something that I would like to not only spread the message about, but just make or help people understand, help women understand that your period shouldn't be so painful that you don't go to work. Your flow shouldn't be exceptionally heavy that you can't go on a run. It shouldn't be, and then again, this is me saying that again, everyone will experience it differently. Every woman will have a different sort of experience when it comes to their cycle. But these are just the symptoms that I was not taught, but made to believe it's normal. And that's why it took me quite a long time to actually get a diagnosis as well, because I just thought it was normal until I started getting the pain in that groin area. And then I was like, this is not normal.
And also, one of the difficulties with endometriosis is that, like you say, you went through a number of tests, a lot of which you think you should pick up something. And often what we know is that the amount of disease often doesn't even match the symptoms. So somebody may be happily going along with like big endometriomas with mild discomfort, and someone just has some fibrosis, but they're always in so much pain that it's actually quite disruptive to their daily life, and often you don't even pick it up on any of the investigations. So it's said that on average it takes about 7 to 10 years for the diagnosis of endometriosis to be made, and that just goes to show that the awareness and so awareness is not readily available for people. And again, most people don't advocate for themselves, and they accept what they are given and they just live with it.
I think that's a very big thing. A lot of people don't advocate for themselves. And I am very stubborn. Very, very stubborn. And if I feel something's not right within my body, I'm going to push. I'm going to push. And it got to the point where I was almost going to give up, because I was like, okay, well, there's nothing else that I can do. And I'm a very stubborn person. I don't give up easily. And it got to that point, but thank goodness I didn't. But it's like you say, if we get a diagnosis of irritable bowel syndrome, or we get a diagnosis of anxiety and depression, we accept it. We like, this is the diagnosis. And then all of a sudden we're not diagnosed with endometriosis, but that could be the underlying or the actual diagnosis at the end of the day. So like you said, it is a difficult thing, because it's, as you mentioned, some people might have, I think, stage 1 endometriosis, which might be classified as not bad, but they'll experience way more pain and symptoms than what someone with stage 4 endometriosis might feel. And that's why it's very different from person to person.
So as Leslie has mentioned, the average time it takes to get a diagnosis of endometriosis is 7 to 10 years. There's a number of factors that contribute to this, from mislabeling to the actual imaging not picking up early stage endometriosis. So the only way that one can actually definitively diagnose endometriosis is by a biopsy. Usually this is done by laparoscopy, or keyhole surgery as we know it as, where we do a little incision in the belly button. There might be a few other smaller incisions on the abdominal wall. We put a camera through the belly button and then we have a look. Having said this, also, as Mandy has mentioned before, stage 1 endometriosis can be excruciatingly painful, because there's a lot of inflammation that's happening and there might not be a lot of disease to see at that point in time. It doesn't necessarily mean just because we haven't found the exact tissue that it's not occurring. Stage 1 endometriosis might not have the big cysts that Mandy mentioned she had, or stage 3 or stage 4 endometriosis, but that is the definitive diagnosis. Having said that, we don't necessarily need histology in order to start treatment. So, Mandy, will you like to just explain to us what your treatment journey or pathway has looked like?
So I started, I think a big thing for me was getting the keyhole surgery done. And I speak under correction here because I'm not sure what was done, but I think they burn out all the excess endometriosis or the tissue.
Yeah.
I was actually in surgery for about 3.5 hours.
Yeah.
There was that amount, huge amount of tissue or whatever in the body. And that was the main point for us to start off with, was that. And then after that, it's trial and error, I believe, because it's not about one size fits all. Okay, now we've figured out you have endometriosis. We're going to do the surgery. We're going to remove or burn out whatever is in there, and you're good to go for the rest of your life. As far as I understand, it's reoccurring, and you need to be able to manage it as you move forward. And like you said, or you asked what treatment plan or how am I maintaining it, with difficulty, because it's about finding the correct way forward for yourself, which I can't say I have 100% found yet.
Okay.
Right. So after the surgery, my period pains were so much better.
Okay.
My period pains were so much better. It's like, is this how it's meant to feel? I'm like, I've never felt this amazing. My periods the flow was so light.
Oh, wow.
And I was like, oh, wow, I can go for a run and not worry about where the next toilet is. Or I can even be brave and not wear black shorts when I go for a run, maybe a short of color. And it was just, I was like, I could feel that there was a huge difference. I started taking a contraceptive tablet. I forget the name of it. And I tend to not be good with taking tablets. Also, I fell off a bicycle and I broke my elbow. Obviously, there's a lot of risks that come, or how would you say it?
So, yeah, like a lot of the hormones that we use, especially estrogen, they are hypercoagulable, meaning they make your blood thicker.
Yeah.
So they do come with, no medication is without risk.
No, exactly.
Yeah.
So they're always warned of.
Yeah.
And I was like, okay, and I stopped taking that contraceptive because of potentially the risk of blood clots. And then I just forgot to start taking it again. And I thought everything was under control. And, I cannot sit here and say I have a way forward of how to manage it or how to maintain it. And I know it's always going to be part of who I am. And it's never going to 100% go away. I do manage my symptoms if we look away from a medical perspective, right? So when it comes to managing symptoms of the inflammation or the pain that the inflammation causes, for me, what really does help is reducing the amount of processed foods that I eat.
Okay.
Exercising when I'm not in too much pain. So exercising, I find that going for a run or going for a walk or moving my body a little bit more helps reduce the pain. And pre-surgery and even post-surgery now, I can tell if I've had a month of eating highly processed foods or if I've had a month of maybe too many beers or excess alcoholic beverages, or if there's been a month where I haven't exercised as I want to say consistently as I usually would, because then the pains that come with having my period are a lot worse. So for me, I've learned that there are natural ways. I'm not saying it makes it 100% better, because it doesn't, but for me there are natural ways that do help reduce the pain to a certain degree. When it comes to a medical treatment plan, I do take responsibility for a lot of that, because I'm not good with taking tablets. I forget to take the tablets that were given, and I'm still trying to find something that works for me and that helps me maintain all the way through.
Yeah. Thank you for that. So just to sort of like summarize it as well, I think important that you've mentioned there is physical exercise. So studies have shown, and it is part of the treatment plan, that physical therapy or physiotherapy specific exercises have been proven and shown to reduce the pain that people experience. So that definitely is something that should be on everyone's treatment plan as a complementary measure. And then, as you said, Mandy, not everything works for everyone. So, endometriosis is a chronic illness. It's the same like diabetes or hypertension. There's no cure for it, but we aim to manage it. And the treatment strategies that we use or employ, some of them will be hormonal. And I just also want to use this opportunity to say that pills, yes, definitely are part of what we have in our basket when we treat endometriosis or a lot of the gynae conditions that we see. But there are other things like LARCs, or long-acting reversible contraceptives. So one of my favorite contraceptives to use is comes in a patch form, simply because it's just easier to administer. So for someone like yourself, or someone who is working, studying, going to school, is in varsity, in our field working night shifts, something like a patch that you only have to administer once a week is easier to employ than a tablet that you have to swallow every day. But that's just my personal preference. The other things that we also have in our hormonal basket is like your GnRH antagonists and agonists, but those do come with a lot of unpleasant side effects, which basically render women menopausal, which is not ideal for like a 16-year-old or even a 32-year-old.
Yeah.
But a multidisciplinary approach is what it sounds like has been your strategy in terms of your diet, your exercise, as well as other medical management. And again, I'd like to just say to the women out there, if something's not personally working for you that your doctor has prescribed, you're well within your rights to go back to your doctor and say, look, we've tried this, but for X, Y, Z, or 1, 2, 3, this is why it's not applicable to me. And nobody will, judge you or feel that, you're not listening. Your gynae is meant to be your partner in your health journey, and is not supposed to dictate to you what is right for you. So as you said, it's a trial and error, and we understand that as your health professional. It's trial and error. If something doesn't work, it is for us to then try something else or pivot from the original plan.
I think it's so important that you mention that, because a lot of people might feel like there's only one way forward. So let's say, for example, you as the medical professional have a patient and you give them option X. They might feel, no one should ever feel this way though, at all. They might feel that's the only way forward. But if that doesn't work for you as an individual, is to be open with you as the medical professional, because you are there to support them. And that's something for me that I've learned over all of this that I'm going through, is verbalize how you're feeling, or verbalize what isn't working. Verbalize what is working well about X plan, or what isn't working well about X plan. And the medical professional will be, let's look if we can do something else. And your gynae or your medical professional or the doctor that you're working with is there to support you. Is there to be with you on this journey and not work against you. And I think, and this might be totally off topic, but I think a lot of women might struggle with that, where they feel like they're working against someone. And that should also not be the case. And it might take a long time, but they need to be able to, like I said, find your voice, verbalize what you're going through, whether it's your symptoms or whether it's your maintenance plan or whether the medication that you're on isn't working for you. Find an alternative way forward, or plan B forward, but always verbalize these things instead of keeping quiet about it.
Yeah, definitely.
That's a great way, Mandy, sharing your story of your treatment journey. Another thing that we must also acknowledge with endometriosis is its impact on infertility. So up to 38% of women who are diagnosed with infertility, they're actually found to have endometriosis, because endometriosis can cause irregular bleeding, so it can cause havoc with your ovulation. It can cause the adhesions can also affect the patency of your tubes. So a lot of women who have endometriosis, it can be stage 1 or stage 2. It actually doesn't really matter, but endometriosis can have a huge impact on infertility. And a lot of the women who are struggling with infertility actually would benefit from a diagnostic lab scope to actually exclude endometriosis, because that can make a huge difference in the treatment.
So endometriosis doesn't just affect your body, it can permeate into different facets of your life, whether it is your interpersonal relationships, your work relationships, and even your mental health. If you suspect that you're living with endometriosis, you are not alone. While this disease might be invisible, it impacts many women and their daily lives. So we implore you and encourage you to please seek help.
So in summary, remember that extremely painful periods are not normal. Heavy periods are not normal. Do seek health advice from your general practitioner or gynae, at least to try and get into the system to be able to be diagnosed. So I hope that today's episode has shed some light into the difficulties of diagnosing and living with endometriosis. And I hope this episode has been helpful, and we hope ziRight girls.